Hi, so thank you for the introduction, Nicole. My name is Tiffany Wincho, and I'm here with my colleague, Amy Freeland. We are both part of the Health Consumer Center at Bay Area Legal Aid. Bay Area Legal Aid is a nonprofit law firm. We provide free civil legal services throughout the Bay Area. We help with various areas of law, which include housing, eviction defense, family, assisting survivors of domestic violence. We do public benefits, which include health insurance, other public benefits such as CalWorks or SSI or Social Security Disability. We have a consumer unit, but we do a pretty large variety of free civil legal services. And the unit that Amy and I work in is our health unit. And I can let Amy introduce herself quickly and then I'll continue.
Good morning, I'm Amy Freeland. Happy to be here.
Okay, and just to give you some background about our Health Consumer Center. So the unit that Amy and I work in, we are solely dedicated to issues regarding healthcare coverage and healthcare access. We provide legal advice, brief services, representation for individual cases, including representation at state fair hearings. We are part of a larger Health Consumer Alliance, which is a statewide group which is solely dedicated to healthcare access. Our unit operates a legal hotline, so the public can call in and ask us questions about how to access healthcare, how to get onto health insurance, if they're having problems with a denial of coverage, or if they can't access prescriptions or anything within that realm of healthcare access. Our services are free. We also welcome all income levels, so there is no income or asset limit in our individual unit itself. The hotline is open Monday through Friday and 9 to 5 p.m. So people would call in, we would do an intake to open up a case for them, and then we would get more information and either provide advice right there on the spot or continue on and assist them with their individual cases. And this is just some of the details about how to access our services. We do have on-staff attorneys that speak various languages. For languages that we do not have on staff, we are able to call a telephone interpreter to provide interpretation. And before we get into the substantive part of our training, we just wanted to give a brief disclaimer. We will be going over quite a bit today, very content-heavy session today. We will leave room for questions during a couple sections. And then our second day, we anticipate that we would answer more questions and have a bit more of an interactive training. And then I'll let Amy take it away.
Okay, so we are not going to spend a ton of time talking about Medicare, but we do want to explain a little bit about how Medicare and Medi-Cal, how they work together and how they're different. Medicare is an entitlement program, and it's based on your payroll taxes and the amount of credits that you've paid into the Social Security system and the Medicare through your payroll taxes, and it is available for people who are 65 and older or are determined to be blind or disabled by the Social Security Administration, and also have enough work credits to qualify for Medicare. There's no eligibility, no income or asset eligibility necessary, and Social Security determines completely whether someone is eligible or not. So, if you have folks who have questions about their Medicare eligibility, they would go through Social Security to figure that out. Medicare covers hospital services, physician services, and prescription drug coverage, whereas Medi-Cal is for low-income individuals, and it provides comprehensive care, including also hospital services, physician services, long-term care, more broadly than Medicare does, And it also, yeah, it covers several things that Medicare does not cover as well. Next slide. Tiffany, can you? Oh, thanks. So whereas Medicare is 100% federal program, Medi-Cal, which is California's name for our Medicaid programs, is a federal and state funded health insurance program for low income people residing in California. It's administered by the Department of Healthcare Services, DHCS, but eligibility is determined at a county level, and the county, for the most part, is the public-facing entity when it comes to qualifying for Medi-Cal. So people can be eligible for Medicare and Medi-Cal at the same time. Many people are. Medicare is always the primary insurance, and it would pay first, and then Medi-Cal is billed after Medicare has paid their share. So Medicare has several parts. Part A is the hospital services, and most people don't have to pay for Part A insurance. Some people can buy into it. It's kind of expensive, but if you qualify for Medicare, generally Part A is free. Part B is outpatient services. That's like doctor's visits and any kind of services that they get outside of the hospital. And Part B has a monthly premium. I don't remember exactly what it is this year, but it's somewhere around $140 a month. And then Part D is a prescription drug part of Medicare. And people have to enroll in a prescription drug plan to get the Part D prescription drugs. Part C plans are optional, and they're also called Medicare Advantage plans, and they are a way that people can get parts A, B, and D kind of combined into one plan, and it's different from original Medicare. So Kaiser offers Medicare Advantage plans. There are a lot of different insurance companies that offer Medicare Advantage plans, and people elect that as opposed to original Medicare, which is fee for service. So, Medicare pays directly for the expenses. So for Part B services, Medicare pays 80%, and then the leftover 20% is billed to Medi-Cal for people who are on Medi-Cal. So people who are not on Medi-Cal are responsible for the 20% copay. People want to make sure that if someone has Medicare and Medi-Cal, they'll want to make sure that their providers that they've chosen accept both Medicare and Medi-Cal. Most providers will accept Medicare, but not every provider will accept Medi-Cal. So they want to make sure that their providers accept both to make sure that the 100% of the bill gets covered. So if someone has Medicare and Medi-Cal, Medicare gets billed first, and then Medi-Cal picks up, a negotiated rate for the rest. And oftentimes the Medi-Cal reimbursement rate is less than what the provider would ordinarily expect to be reimbursed, but the providers are not allowed to bill the patient for the remainder. We call that balance billing, and that is so if they accept Medi-Cal and they accept payment from Medi-Cal, then they're not allowed to bill the patient for the balance of the bill. So Part D prescription drugs have a copayment, low copayment for generics and brand names. And Medi-Cal does not pay for drugs that Medicare will pay for.
Okay, so I will start getting into the Medi-Cal portion of our training. This slide is just an example of the different types of Medi-Cal eligibility categories. Like Amy said, for Medi-Cal, it is based on your income, in some cases your asset limits, but it's financially a needs-based program. And then there are different categories of groups of people that qualify for Medi-Cal. And these are just some of the more common groups. There are a large number of Medi-Cal categories. But for example, someone that is receiving supplemental security income or who receive CalWORKs automatically qualify for Medi-Cal. They do not have a separate application, but they automatically get Medi-Cal benefits purely because they are receiving SSI or CalWORKs. And then there are seniors or persons with disabilities, low-income adults, which is the expansion category created by the Affordable Care Act, and some of these other groups as well. This slide is just an example of the income limits that Medi-Cal has. It will vary for each group of category. The income chart that we provided goes through each of the more common income levels. It's based on your household size and the income level. All of it is based on the federal poverty level, but as you can see, it can vary amongst the programs. A single adult on the expansion category of 19 through 64, their gross or taxable income has to be less than $1,482 a month, whereas someone that's on the working disabled program could earn up to $2,684 a month. And one other thing to add is that it is important which category someone qualifies under, because each category might have different income counting rules and different exceptions for income. So it can really vary the types of income that's counted and how much. So for Medi-Cal, beyond your income or other financial qualifications, you have to be a resident, and you also have to meet Medi-Cal's citizenship or immigration criteria. Generally, every individual could apply for Medi-Cal and receive some sort of Medi-Cal benefits, assuming they also meet the income criteria. But there are different levels of Medi-Cal coverage. Someone that would receive full scope benefits, which is generally comprehensive Medi-Cal coverage that is free. To qualify, you have to be a citizen or be a qualified immigrant. Qualified immigrants is a federal statutory designation of immigrants that are eligible for Medi-Cal. Common categories are legal permanent residents, green card holders, those that have been granted refugee or asylee status, victims of trafficking or U visa holders, and other qualified immigrants. Then there is what is called restricted scope Medi-Cal. Restricted scope is for those that do not have one of those qualifying immigration statuses designated by the federal government. So there are individuals who could be lawfully present, but who are not considered qualified for Medi-Cal purposes, and also those that are undocumented. Then there is another category called PRUCAL. PRUCAL stands for permanently residing under color of law. This is a very specific public benefit eligibility category. It is not an immigration status, but it does offer a path to full scope Medi-Cal for some individuals that do not meet the qualified immigrant status for Medi-Cal purposes. Essentially what PRUCAL is that immigration authorities know that you are here and present in the US, and they're not intending to begin any deportation proceedings against you. DACA recipients is a common example. Deferred Action Childhood Arrivals, they would qualify for full scope Medi-Cal under PRUCAL, whereas this group would not qualify for benefits with Covered California. So there can be differences in how different categories of immigrants are treated under Medi-Cal and Covered California. To allege PRUCAL, you would submit the MC-13 form. Eligibility under PRUCAL is done by the county, and it's not uniform. Some counties view different different immigration statuses differently. So it's really a county by county designation. This slide is just an example of the immigrant statuses that are considered qualified for Medi-Cal purposes. And like I said earlier, there are different types of Medi-Cal coverage. Full scope is the most common type of Medi-Cal coverage. That eligibility slide that I discussed earlier, slide 7, all of those categories are mostly considered full scope Medi-Cal, which essentially just means that it is free. There is no cost sharing. There is no payment expected for services. This category is comprehensive. Any medically necessary services, there should be zero cost to that Medi-Cal individual. Then there is share of cost Medi-Cal, which is a traditional Medi-Cal category that's been around for a very long time. And that's for individuals whose income is too high to qualify for that free full scope Medi-Cal. They don't meet the income limits, essentially. Share of cost Medi-Cal can be very expensive. It's not a health insurance category where you pay a monthly premium, but it operates more like a plan with a high deductible, which means that someone with a share of cost is obligated to pay towards their healthcare cost in that month. Medi-Cal will not kick in once that monthly deductible or share of cost has been met. You can pay towards the share of cost, which essentially is just healthcare bills that you receive for services on behalf of yourself or for other family members. It restarts monthly, which means that you might have met it in the month of May, but the next month in June, you would have to again pay towards your costs before Medi-Cal would kick in. And then there is restricted scope Medi-Cal. Restricted scope Medi-Cal is free, but it's only covered for services that are limited to emergency services, pregnancy-related, and long-term care. Those on restricted scope are, again, those immigrants that don't qualify under the qualified immigrant status or under PRUCAL for Medi-Cal purposes. And I will get into share of costs later in the presentation. So this slide is for Medi-Cal expansion. Expansion Medi-Cal is essentially the categories of Medi-Cal that were created under the Affordable Care Act. The expanded or expansion Medi-Cal categories have a different income counting calculation. They generally have higher income limits, and most importantly, they do not have an asset test. So traditionally, Medi-Cal before the Affordable Care Act, there was always an asset test. Under the expanded categories, that does not exist. Money in your savings accounts, checking accounts, cash, or personal property is also not counted. You could have multiple homes and also qualify for Medi-Cal under this expanded categories. Medi-Cal expansion is based on the tax code. The income that they use to determine eligibility is termed MAGI, which stands for Modified Adjusted Gross Income. And you get that MAGI number by taking your adjusted gross income plus adding any non-taxable Social Security benefits, such as Social Security disability or retirement that is not typically taxable, or tax-exempt interest that you might have, or foreign earned income or housing expenses. Again, because it's based on the tax code, it's looking at the tax return for those that file them. It would be the AGI on 8B on the new IRS form. Under the MAGI categories, because it's based on the tax code, there are also some tax deductions that might not be eligible, that might not be existing in the non-MAGI categories. So some common tax deductions would be student loan interest that someone pays. If they're self-employed, they also get to take deductions based on that. And then there are income exceptions where that income is not counted at all towards Medi-Cal. State disability insurance is a common example, as well as financial assistance that someone receives for tuition. Under the Medi-Cal expansion categories, the income level that someone needs to meet is based on their household size. Traditionally for Medi-Cal, your household was based on a more traditional format. It was your spouse and any minor children that you had in the home. Under the expansion categories, because it's based on the tax code, it's based on your tax household size. So that means your Medi-Cal household is going to be your tax household and whoever is in it. It could be the tax filer, your spouse, and any dependents that you claim in your tax household, even if your dependents are not minors and could be full-fledged adults. Then there is some common income deductions or exceptions. Like I mentioned earlier, self-employment income is a common one. There's another special income rule for IHSS caregivers. IHSS is a program offered by Medi-Cal. If you are an IHSS caregiver or provider, if you live in the same home as the recipient of your IHSS services, the income that you earn as an IHSS provider is completely exempt for Medi-Cal purposes. So the actual gross income in the household might be a lot higher than what is actually countable for Medi-Cal. So when we're thinking about Medi-Cal categories of eligibility, it's always very good to figure out what program this person qualifies for, because that's going to really change the income that you count and whether or not they would qualify for that free Medi-Cal. So those previous slides were all about the expanded Medi-Cal. Now we'll talk about the non-Magi Medi-Cal, the categories of Medi-Cal that existed before the Affordable Care Act and that do not follow that Magi income calculation. Non-Magi programs have both income and asset requirements. Common non-Magi programs are the aged, blind, and disabled, the 250%, and then the share of cost and those that are in long-term care and nursing facilities. The countable income for these categories is income after all applicable deductions are made for these type of categories. And then we'll go into more detail in a little bit. Asset limits, like I said before. For age, blind, and disabled, the rules for qualifying are for individuals that are 65 and over or under 65 and disabled. So they could be receiving Medicare. Then they would be assessed under the age, blind, and disabled program. There's also the 250 working disabled program, which is for individuals who are disabled and are over income for the aged and disabled. There is a small premium that one has to pay for this program, but it has a lot of benefits, and we'll get into that later. This slide is just a good way to look at the difference between the traditional Medi-Cal and the modified adjusted gross income Magi categories. So for the non-Magi programs, such as the age and disabled program, there's going to be an asset or resource limit. The asset limit for a single person is $2,000 in the month. That means that at the end of the month, you can't have more than $2,000 in that account. For a couple, it's $3,000. You are allowed a home that you own, but you have to live in that home. If you do not live in the home, it is counted for Medi-Cal purposes. If it's over $2,000, you're going to be disqualified from Medi-Cal. You're also allowed one car for transportation. If you're a couple, you can have 2 cars. Work-related plans, retirement plans, such as IRAs or 401ks. If you are the applicant for Medi-Cal, if you have that 401k or other pension plan, if you receive payments of principal and interest from that account, the entire remaining balance would be considered unavailable. But if you are not receiving payments of principal and interest, that entire balance is going to count towards you. If you have a family member in the home that has one of these accounts, it could be exempt completely if that person is not applying for Medi-Cal themselves. So the asset limits for Medi-Cal are pretty low. You also are allowed a life insurance policy. It's exempt if the face value is $1,500 or less, or irrevocable burial trust or burial contracts would not be counted. For the non-Magi traditional programs, the countable income is your gross income minus some deductions. The deductions aren't as numerous as in the MAGI categories, but you can deduct any medical insurance premiums that you pay. Common ones would be Medicare. Medicare, like Amy says, does have a monthly premium. For your Part B, you can deduct that. The Part B premium changes every year. If you have other supplemental insurance, some people have a Medigap plan, or Medi-Cal does cover vision, but it can be limited. So you could also buy an extra vision plan, but you could buy supplemental insurance and deduct those monthly premiums from your countable income for these categories. There's also an automatic $20 deduction, and then any employment income that you earn, which is called earned income. There are some decent deductions. You would deduct $65 from that employment income that you have. If you are disabled, you can deduct any impairment related expenses that you paid so that you remain employable, or any income related work expenses such as transportation or uniforms if you are blind. And then after you subtract all of those deductions, you would divide in half the balance of that remaining employment income. So for Medi-Cal, the actual only countable employment income that you would count is going to be a lot lower than your gross income. So for example, Joe earns $3,000 a month in employment. He's not blind, he is disabled, but he doesn't pay those income impairment related expenses to remain at his job. You would take the $3,000 minus the $65 off the top, and then divide that number in half. For Medi-Cal, they're only going to count $1,467 for Medi-Cal purposes. If you have a spouse who is also employed, you can use those deductions as well. So if you, despite all those deductions, you're still over the limit for free Medi-Cal under the Aged and Disabled program, you might have what is called that share of cost. And the share of cost, again, is like it's like a deductible. You have to pay that amount before Medi-Cal will kick in, but you don't actually have to pay the share of cost if you don't use services in that month. But your share of cost is going to be calculated by the county. It's your countable income minus what is called a maintenance need level for that household size. The maintenance need level is set by the government. It's the amount of income they allow a beneficiary to retain to pay for your rent, food, utilities. It is standard, and it does not take into account cost of living. So it's not going to vary from the Bay Area to the Southern California. It is the same number for the entire state. A single person, that maintenance need level is $600. A couple is going to be $934. So to calculate your share of cost, you're going to take your non-exempt income. If you had medical insurance premiums, you can deduct that. But if you don't, it's just going to be your gross income minus a $20 deduction off the top, and then minus that maintenance need level to get to that share of cost number. The share of cost will vary from individual to individual because it depends on that individual's income. So for example, someone that has $1,750 in Social Security retirement, they get an automatic $20 deduction, and then they are single, so they can take $600 off. Their income, their share of cost is going to be $1,130 that they are expected to pay towards their services before Medi-Cal will kick in. So it can be very high. It is definitely operates as like catastrophic coverage at times, but the share of cost, unfortunately, is really not affordable for most people. Common strategies to meet the share of cost that we advise our clients can vary, but again, because it's so expensive, some of these strategies just aren't going to work depending on how high your share of cost is. There are people that have share of cost of over $2,000 a month, and that is just an extremely high number. But some ways that you can strategize around the share of cost is to, one, combine any unpaid bills in 1 month to meet the share of cost. because you are obligated to pay for a certain amount of your medical services, you can gather several unpaid medical bills and submit them to Medi-Cal. So for that 1 month, you've expended, 1,000 plus or whatever your share of cost amount is in that month. You could also group your health services into as few months as possible so that you just sort of, front end all of your services and you only pay the share of cost maybe 3 to 4 months out of the year. Any medical expenses that you pay on behalf of another family member can also be used to meet that share of cost. And the share of cost, when you go to get services from the doctor, they will run the Medi-Cal number. That doctor will see that this person has a share of cost. So they would expect that person to pay for whatever the bill is for that day. And that's how Medi-Cal works the share of cost. Another strategy to reduce or eliminate the share of cost altogether, not just meet the share of cost in that month, but reduce the amount that someone has for a share of cost or get rid of it, is to buy supplemental medical insurance. Because medical insurance premiums can be deducted from your monthly income, if you can get your monthly income to below or at the Asian disabled limit, you could get onto free Medi-Cal and eliminate your share of cost. We have for 2019, the income limit was 1,271. Now for 2021, it is 1,482. But essentially, the monthly medical premiums that you pay for supplemental insurance can be deducted to make you qualify. So for example, someone that is trying to get on the age and disabled program, if the income limit is 1,482, let's say that their income is at 1,550. If they just pay $70 or so in extra medical insurance premiums, they can submit documentation that they pay these extra $70 and get themselves below 1,482 for countable income purposes. Premiums that you also pay on behalf of other family members also would count. And then another program that we advise on is the 250% working disabled program, and we'll get into that in a little bit. So here's an example of someone who is using the medical insurance premiums to try and qualify for Medi-Cal. John and Jane are married, they live together. They're 65 years old, so that means that they would be evaluated under the age and disabled program. John gets $1,000 in retirement and Jane gets $1,100. They both pay combined $268 to pay for their Medicare Part C plan. Would they be considered eligible for free and full scope Medi-Cal? The income limit for a household of 2 people is $2,004. So their combined income is $2,100. That is over the limit. So just based on their combined income alone, no, they wouldn't qualify. But they are allowed that $20 automatic deduction and the $268 that they pay for their Part C premiums. So their actual countable income for Medi-Cal is only $1,018.12. $1,018.12 is less than $2,004, so they do qualify for free Medi-Cal. And I'm gonna hand it over to Amy.
So the 250% working disabled program is another tool that we use for people that would otherwise have a very large share of cost, or any share of cost. And it's a really, really great program, and a lot of people aren't aware of it. So, we are always happy to advise people so that they can get on the 250% working disabled program. So this program is for people who are would not be in the MAGI category. It's for people that would otherwise be in the aged and disabled Medi-Cal. So it provides full scope Medi-Cal with a monthly premium, a small monthly premium to working disabled people with accountable income below 250% of the federal poverty level. So the criteria for this program are that you have to be disabled which means that you have to have either a Social Security determination of disability or a Medi-Cal determination of disability. Usually people get their Medi-Cal disability they get their disability determination through Social Security. But for some people who may not, there are certain categories of people that may not be eligible for Social Security benefits, and so Social Security won't do a disability determination. And in that case, Medi-Cal, the state, has the ability to do its own disability determination. So they just have to have either the state or Social Security determine that they are disabled under the those program rules. And they also have to have engage in minimal employment. And we get, callers, and when we start to explain about the 250% program, they hear working disabled, and they say, no, I can't do that. I can't work. I'm disabled. But the great thing about this program is that there's no minimum hours, no minimum wages to qualify. So, I mean, it's not, it's a pretty open secret that people will engage in minimal work just to qualify for the 250% working disabled program. So these are some of the examples that we've, of the types of work that we would have people do in order to qualify for that minimal employment criteria for the 250% program. So it could be, someone who babysits their grandchildren for, $10 a week, or they water their neighbor's flowers, or they drive someone to appointments. We've had people collecting cans. Really, I mean, there's really no minimum to the amount of work it is. You just have to kind of have an attestation that says from the other person who is employing you to do something, what the nature of the employment relationship is, how long it's supposed to last, just some minimal information. And once that's on file, then that would be sufficient. So under the 250% working disabled program, all disability income is exempt. So this is great. So this program is great for people who are on disability, or even retirement. People on retirement can qualify if they had previously a disability determination before they shifted onto retirement. So say someone makes $2,000 per month in SSDI income. They would be too high for regular free age-and disabled Medi-Cal without a share of cost. But under the 250% working disabled program, that entire $2,000 would be exempt. And the 250% portion of the income limit is for the employment income, or the employment income. So, and the monthly premium, they do have to pay a monthly premium, but that's based on a sliding scale, and it's determined by the non-exempt income. And the lowest monthly premium is $20. So a lot of the people who are enrolling in this program with very, very minimal work, the people who are doing the babysitting or the watering flowers, that kind of thing, generally pay a premium of $20 per month, which you can see is way superior than having to pay, $1,000 or $1,400 per month in a share of cost before the Medi-Cal would kick in. The program also allows people to separate, to save, because the whole point of the program is that they want to encourage people to work. And so they want to encourage you to save too. So for this program, the regular $2,000 asset limit, or $3,000 for a couple, still applies, except you can take the money that you get from your employment and put it in a separated bank account, and you can save that. You can just keep saving that money, and it doesn't count toward that asset limit. It's just separated from the money that's counted towards your asset limit. I think that is all that I have on the 250% program, but we're definitely going to open up for questions in just a minute. So we'd be happy to answer more questions on that. So adult Medi-Cal dental benefits. As a side note, children on Medi-Cal they also qualify for dental benefits. They always have, and the states are required to pay more comprehensively for dental benefits for children under 21 than they are for adults. But for Medicaid programs in the US, dental benefits are optional for the states. And for a while, California had cut out dental benefits from Medi-Cal and didn't provide them. But as of 2018, I believe, they put dental benefits back into Medi-Cal as a covered benefit. And it's paid fee for service, which most people who receive Medi-Cal are part of a managed care plan like Anthem or Santa Clara Family Health Plan in Santa Clara County. And Valley Medical Center is a subsection, can be a subsection or subset of the, that managed care plan. But Denti-Cal benefits are just directly paid by Medi-Cal. So these are some of the examples of some of the services that are covered under Medi-Cal dental. Medi-Cal dental and Denti-Cal are the same thing. So I'm kind of using those interchangeably here. But they mean the same thing. So exams, cleanings, fillings, just general dental treatments, but also root canals of front teeth, full dentures sometimes. So there are a lot of different dental services that can be covered under Medi-Cal dental. There are lots of different rules about when you're eligible for this or that. So there's a lot of caveats there, but it is great that this Medi-Cal dental benefits have been opened back up to the adult population. So for dental benefits, up to $1,800 in covered services are available per year. I put a star there because there are a lot of caveats there. For example, people who are on pregnancy Medi-Cal don't have a cap for the amount of dental benefits that they can get. And also, I believe that dentures don't count. Some of the very expensive medical services are not counted in that $1,800. And also people who have greater than $1,800 a month in dental needs could get more. They just have to go through a little bit more of an involved process to getting Medi-Cal to approve it. So this is a big thing that a lot of dental offices don't fully understand, is that if a dental office accepts Medi-Cal and they take payment from Medi-Cal for a dental service, they cannot bill the patient for the balance of the bill, just like I had talked about before with Medicare and Medi-Cal. If a dentist accepts Medi-Cal and they accept payment, then they're accepting that is payment in full. So that's something kind of we keep an eye out for, because a lot of dentists don't know that. So the telephone service center, that number is kind of the catch-all number if people are problem with Medi-Cal dental is just the network adequacy. It can be difficult for people to find dental providers it's usually pretty easy to find a dental provider to do cleanings and fillings and exams and fluoride treatments. But when it comes to doing full dentures and root canals, that kind of stuff, it can be tricky for people to find dental providers that will take Medi-Cal for that. Because the Medi-Cal reimbursement rate is really low. So, it's not lucrative for them to accept Medi-Cal for those services. But under the rules, Medi-Cal dental, they're responsible for helping, a person find a provider that can, provide the services that the person needs. So if someone is having trouble finding a dentist that will provide the service they need, they can call that telephone service center line and kind of, push to have them help you find a dentist to provide the service that you need. And if they still don't, then tomorrow we're going to talk more about appeals and what can be appealed. But network adequacy is an issue that can be appealed if a person just cannot find a provider to provide the service that they need. Then that's something that that's an appealable issue. Next slide. So this is just how to apply for Medi-Cal. They can do it online. The counties want you to do it on coveredcalifornia.com. And that's kind of a streamlined application where if your income is in Medi-Cal territory, then they forward it to the county. And if it's in covered California territory, then Covered California will hang on to it. In person, that's a little, I believe most of the offices have activity going on now. And if a person, they're entitled to either, if a person with disabilities may need help with filing an application, they should help, they're supposed to help. And they also should provide language services for a person who is not English language proficient. So this accelerated enrollment section is brand new. In fact, we just heard about it last week. It was the result of a big settlement with the Department of Healthcare Services. And this program is going to grant temporary Medi-Cal benefits for applicants while their eligibility is still being assessed or processed. So in the past, you would have people that in different counties are better or worse about processing Medi-Cal applications, but sometimes a medical application might get lost. And so a person is waiting months and months and are not able to get the care that they need in the meantime. So this program is a new temporary category of Medi-Cal that gives people benefits while their application is still being processed to see if they're eligible for full scope Medi-Cal. So, and that program will be effective July 2021 for applications that are through coveredcalifornia.com. There are other kinds of Medi-Cal applications. There are different eligibility systems that they use, like technology systems that they use to determine eligibility, and the one that's at coveredcalifornia.com is a little bit easier for them to make changes to, so they can that one will be effective July 2021 for those applications, and they're working on getting it for all applications, but they are not making any promises before 2023. So at this point, I think we have more content Covered California specifically, but at this point we wanted to open up for questions that people might have on what we've gone through so far, Medi-Cal or Medicare, anything like that.
Thanks, Amy. And I already see one question in the chat, but want to again encourage everyone to pop your questions in the chat. But I know there are a number of people who have joined in by phone. So if it's easier for you to come off of mute to verbally ask your question, please go ahead and do that. But we'll start with the question that is in the chat. So it's around, they were not sure how you determine the eligibility in the first example. I think that Tiffany went over. So could we please either go over that once more or provide another example to illustrate that eligibility determination?
Yeah. Let me try and go back. Let's see if. Eligibility for Medi-Cal, there's just different ways that you can qualify. Medi-Cal can say that you're categorically linked. So someone that is a senior over 65 or someone with Medicare disability, they're considered linked to Medi-Cal based on that disability. So before the Affordable Care Act, you had to have a link. You had to be a parent You could be a child, you could be a senior or someone with a disability, or if you received CalWORKs or SSI. But they didn't look at you, they didn't offer Medi-Cal for people that were just beneath a certain income limit. And then with the Affordable Care Act, that changed things. So that's how the expansion categories came to be. So now with the expansion categories, you can just be a low income adult, age 19 to 64 and be on Medi-Cal. You don't have to meet either the age requirement of being a senior or have a child or be pregnant. They just simplified it based on income. And then when you apply for Medi-Cal, the county is going to look at, what is the income level for you? They're going to go through the different categories and see, which program that you might fall under. If you're age 65, they cannot look at you under the Magi adult 19 to 64 program. That category is age barred after you're age 64. But if you are 35, for example, they will most likely look at you under the low income adult program because that has the highest income limit. And it's the easiest to qualify for. You don't have to show some other linkage towards that program. And then they're going to look at, do you meet the residency requirements? Are you a California resident? And do you meet the citizenship or immigration criteria? And if that didn't answer your question, let me know.
I don't know. They may have wanted one of the examples that I don't know. Maybe it was the share of cost example that you gave in the PowerPoint. I'm not sure. But I can answer while she's looking for that. I can answer the next question about can seniors who do not have Social Security qualify for Medi-Cal? So they can, definitely. So for seniors who are 65 and older and they don't have Social Security, that's fine. If they had Medicare and Medi-Cal, that would be fine, but they don't have to have Medicare and they don't have to have Social Security. They can still qualify for Medi-Cal because it's aged. So Magi Medi-Cal is for the younger non-disabled folks, but the 65 and up Medi-Cal is for people who are either have a disability or are older than 65. So they would need to qualify under the immigration rules that Tiffany has already talked about. But they would also, so one of the main differences between the Magi Medi-Cal for the younger people without disabilities and the aged and disabled Medi-Cal is that the aged and disabled Medi-Cal does have an asset test that the Magi Medi-Cal doesn't have. So they would have to qualify, not have too many non-exempt assets to qualify, whereas Magi Medi-Cal folks wouldn't have to worry about that. But the income limit for people, for people who are living on savings, it really depends on what form those savings are in. If it's cash, that's going to count as an asset, so they wouldn't qualify under that aged and disabled Medi-Cal because there is that asset test. But some people are living off of retirement accounts like IRAs or 401ks, and they're taking out, if they're over 70 and a quarter or something, then they have to take the mandatory minimums each month. And for everyone else, they just have to be taking regular disbursements of principal and interest. So even if someone is sitting on a $400,000 like IRA and they're taking out, $1,000 a month of that as income to live on, then the retirement account would be excluded, and only the income that they're taking from those disbursements would count as income. So I don't know, I hope that answered your question, but let me know if there are additional questions.
Before we get to the example on the slide, there's also a quick question on if someone wins money at a casino, do they have to report that to Medi-Cal?
Yes, it's going
You have to report all income to Medi-Cal.
So maybe we can,
within 10 days, you need to report.
so maybe we can go over this example on the slide, and then Bridget has a question they'd like to ask and come off of mute, and then maybe we can return to some of the content and leave the questions for later.
Yeah, and I'll go over the share of costs quickly. So for a single person, if you, the share of costs is also a more traditional program. So most likely if you are age 19 through 64 and you do not qualify for the expansion categories, you're going to be moved to covered California. Share of cost is a traditional Medicare program, a Medi-Cal program for those that are over 65 or have a disability or have Medicare. So under the share of cost, if you do not qualify for the free aged and disabled program, the income limit in 2021 for a single person is $1,482. So someone that earns or receives $1,750 does not qualify for that full scope aged and disabled. So the county will then do a different income calculation to get that person onto share of cost Medi-Cal. So if they have $1,750, they get that $20 off the top minus the maintenance need level. That's where that $1,130 share of costs comes in. And that means this specific person is expected to pay up to $1,130 in any month that they receive medical services. So it's not a premium. You don't have to pay the $1,130 every month. It's just when you actually use services. And again, it's just a cap. So if you do use services, your doctor's visit costs $200, you would pay $200. You don't have to pay the $1,030. If you don't use any other services in that month, $200 is the only amount that you'll pay. But if you are someone that is using medical services often, then you will be expending quite a bit out of pocket. And it's only after you've met your share of cost of $1,130 will Medi-Cal then become active and pay for any services you receive in that same month. And I hope that answered the question. But if not, let us know. And again, we can also go over more examples in the second training. Share of cost is a very complicated topic. In general, eligibility for Medi-Cal is complicated because there are different rules for each program. I think as we did in the slides, Social Security disability is treated differently under the 250% working disabled, but it's also treated differently under the Magi program or the aged and disabled. So it's really hard to, determine, what income is counted on a general basis because it's just going to vary amongst the programs. And we always encourage, if you have someone who has questions about their Medi-Cal or they have a share of costs and it doesn't seem right, to call our hotline because then we can go through that evaluation. I think we could do the
I think that
next.
Bridget is going to ask a question verbally.
Yes. Hi, everyone. So my question is kind of two parts. So if you're a senior citizen collecting your Social Security retirement benefits, however, still employed full time, can you, one, apply for Medicare, and two, would it reduce the retirement benefit?
So, yeah, if someone is working full time but they're 65, so Medicare, unlike Social Security, that you could which you can, when you decide to pull it, it changes how much you're going to get. If you pull when you're 62, you're going to get less for the rest of your life. And if you,
I'm sorry, you're breaking up. So I'm hearing like every other word. I don't know if it's on my end.
Up to 70. Then with Medicare, once you qualify for Medicare,
Amy.
it's probably here.
Yeah, I'm not hearing.
I can answer that. Yeah, if you're over 65, you can qualify for Medicare, but you don't have to take it if you're employed and have coverage through your employer. But it can get a little bit tricky because Medicare also has rules about late enrollment. So someone that didn't sign up for Part B when they were supposed to might incur an additional penalty on top of the monthly premium once they get it. But if you are employed, you can sign up for Medicare. It's just a question of, do you need it? And it's good to know all the rules that are involved around Medicare, because they can have high penalties. So just to make sure that someone doesn't get a surprise down the road. And then if they need Medicare, if they want to qualify for Medi-Cal, they would count the Social Security retirement, and the employment income would also count, but it would also be subject to those deductions that we discussed earlier. So that full employment income wouldn't be counted. If they're employed full-time, it might be pretty high for Medi-Cal, but you would just have to do the minus 65 and probably divide by half to see if they could get on the free Medi-Cal program for the employment deductions.
So specifically for Medicare, it wouldn't or would reduce the Social Security retirement benefit?
Oh, for that question,
It wouldn't.
Okay.
Yes.
But
So
you
it
could
has
incur
no
a penalty
effect
or
on
something like
your
that.
Social Security benefit.
Yeah, we don't practice in Social Security retirement itself, so we're not as familiar. Amy has a little bit more experience.
There's a late enrollment.
And then, yes, there is a late enrollment penalty for signing up for Medicare when you would have been eligible. So when you become eligible at age 65, you are required to get your Medicare and sign up so that they can start charging you and providing you insurance. But there are some exceptions to that rule. If you have other health coverage through an employer, you can delay your Medicare enrollment. But you do need to be careful that your other coverage through your employer actually meets the exception rules for Medicare. And most of the time it does. It just can get a little bit complicated. So we always advise people before they make that decision to speak to someone that is knowledgeable about the late enrollment penalties, just so that, 5 years down the road, you stop your employment insurance and you sign up for Medicare and you find out that other insurance you have actually didn't meet the exceptions under Social Security Medicare rules.
Okay.
Nicole, do you want us to move on and then answer these questions at the end, or just keep answering them as they come?
Depending on if the Cover California piece you think is going to take a bit of time, I might suggest that we move on and then leave some time at the end for some of those questions. Or Dave.
It's definitely shorter than what we've got, a lot shorter than what we've gone through so far. I can just go through Cover California real quick, just so that we can get through it. So Cover California is an exchange, a marketplace that was created as part of the Affordable Care Act. And so can you skip to the next slide? A major part of Cover California that makes it a desirable program is these advanced premium tax credits. That's what makes Cover California plans more affordable. So Cover California is the marketplace where you can buy private plans, and these advanced premium tax credits are what makes those plans affordable. So how do the tax credits work? So you can apply by phone or with a broker, but most people apply by just going to covercalifornia.com. And there's a really great tool called the Shop and Compare tool, which is where you can kind of estimate how much in tax premium assistance you'll be eligible for. And then you can go ahead and enroll in a plan from there, assuming that you're in a proper enrollment period. So there are 3 types of plans: bronze, silver, and gold plans. And this is federal. This is not only Cover California. The Affordable Care Act breaks health plans up this way. And so a lot of the so silver plans are kind of the benchmark plans. That's kind of what a lot of other things are based on, and I'll kind of refer back to that. But silver is kind of the benchmark. That's what they assume that you're going to get. Can you go back, please? Okay. So how the advanced premium tax credits or APTs work is they reduce the amount of your monthly premium, and that Covered California pays these directly to the health plan. And then, so let's say, it's the market price for the health plan is, $1,000 a month. And then you're eligible for $800 in APTCs per month. Then, you would pay $200 directly to the health plan. So both Covered California and the consumer pay directly to the health plan, and you don't pay anything to Covered California directly. Is based on your annual income. Why? To estimate what your, let me know if you're not able to hear me.
Amy, could we try and maybe turn off your video? Sometimes that helps with having the audio be a little smoother. Okay, let's try this.
Yeah. Okay, sure. Sorry about that. Yeah, the Covered California benefits can be a little bit tricky because you have to estimate what your annual income is going to be for that year. So if you sign up for a 2022 plan in December, your application is you're going to have to just kind of guess what your income is going to be that next year. And then it's your responsibility to update Covered California with any changes to that estimation. And that kind of got really tricky last year with the pandemic. And tomorrow we are going to go over a lot of adjustments that have been made to Medi-Cal and Covered California rules directly related to the pandemic. So these slides are ones that you can reference at any time. And then we're going to specifically go through what's changed due to the pandemic next session. So moving back to what I was saying. So you estimate your income, and then when you file your taxes the next year, and you have to file your taxes for that tax year, that's a criteria of qualifying for Covered California is that you agree to file your taxes. And when you file your taxes, what you received in these advanced premium tax credits is compared to what you should have gotten based on what your income actually ended up being. And so if you ended up getting less than you were entitled to, then you can end up with a credit on your taxes. But if you reported that your income was lower than it ended up being, then you can end up with a tax debt. And unfortunately, we've seen a lot of really sad cases of people who didn't know that they needed to report changes and ended up with, multi-$1,000 overpayments to the debts to the IRS for that reason. So it's really important to report changes to Covered California throughout the year. Okay, next slide. Okay, cost sharing reductions go hand in hand with the advanced premium tax credits in making Covered California plans more affordable. But instead of impacting the cost of the premiums, they impact the cost of deductibles, co-insurance, and copay amounts. So, if you have a health plan and there's a $1,500 deductible, if your income is below 250% of the poverty level and you select a silver plan, then that could really lower the amount that you have to pay toward whatever the service or the prescription or anything was. So that's really great way to, in combination with the APTCs, to reduce the costs of a private health insurance plan. And you don't have to reconcile these. So at the end of the year, if your income ended up being a little bit higher than 250%, then that, it's not a problem. It won't affect you negatively, as far as I know. Correct me if I'm wrong, Tiffany. Okay, next slide. Okay, so who is eligible for Covered California? I mentioned before that Covered California itself is a marketplace, and then the APTCs and the CSRs, or the cost sharing reductions, are the benefits that make the plans affordable. So many people may not qualify for the APTCs or the CSRs, but they can still enroll in a plan and just pay the market rate. That's for a lot of people just unreachable, inaccessible, because the market rate for health plans is just really high. And the lower cost ones have higher deductibles and copays. So it's really tough for a lot of people if they don't qualify for these tax credits or cost sharing reductions to afford a Cover California plan or any health plan on a private marketplace. So the income limits are between 139 and 600% of the federal poverty level. And this is new, and these numbers are specifically for California. There are several different ways in that Cover California plan rules or program rules are different from the federal rules. So starting in 2020, California began offering its own tax credits, advanced tax credits that are in addition to the federal ones. So for federal tax credits, 400% of the federal poverty level is the hard cap. So if you make more, before these state tax or tax credits were implemented, if you made $1 over the 400%, you were eligible for nothing, and it's a cliff basically. But since the state of California started offering its own tax credits that increases the income limit that you can have and still qualify for premium assistance for a health plan in Cover California. So that's a great thing that California has done. So generally, the number 139 is kind of odd, but that's 138% and below is the income limit for qualifying for Medi-Cal. So if someone qualifies for Medi-Cal, they have to take the Medi-Cal. You don't get to like choose or keep your Medi-Cal plan or your Cover California plan if you qualify for Medi-Cal. But sometimes there are people who don't qualify for Medi-Cal. So if those people have incomes between 100% and 138% of the federal poverty level, they may still qualify for Cover California APTCs if they have income in that level. An example would be people who are on like work visas would not qualify for full scope Medi-Cal, but they do qualify for Cover California. So if they have incomes between 100 and 138, then they would qualify for the assistance. So the Cover California income counting rules are the same as the MAGI income counting rules. So Tiffany went through the MAGI income counting rules earlier, and so Cover California is the same. So it's all based on your tax filing household. And so if something is taxable, usually it counts as income for Cover California purposes. So immigration, the rule for Cover California benefits, and this is based on the Affordable Care Act, is lawfully present. And that's DACA recipients are excluded, but people who are legal permanent residents or are on basically any other kind of residency visa would qualify to get benefits under Cover California. So if you're on a student visa or if you're on a work visa, then you would qualify for the premium assistance under Cover California, assuming you met all other eligibility criteria. And another big criteria for Cover California is that you must not be eligible for other minimum essential coverage. And so the minimum essential coverage is defined by the Affordable Care Act. And it kind of goes through their criteria, like things that are must be covered for it to count as minimum essential coverage. And so you can kind of look that up. It's, there are several things that they have to cover it in order to count as minimum essential coverage. So if someone is offered affordable employer coverage, then they can't turn that down in order to accept Cover California. you have to, if it's considered affordable, which is a percentage of your income that changes every year, then that's when you have to take that other plan that's offered to you. I can't remember what the numbers were. Oh, I think I wrote it down. It was 9.83% of your income is considered affordable for 2021, except tomorrow we're going to talk a little bit about some changes due to the pandemic. And like I said earlier, you can't decline Medi-Cal because you want to keep your Covered California plan. If you're eligible for Medi-Cal, you have to take it instead. I mean, you don't have to take it. You can decline Medi-Cal, but then you wouldn't be eligible for the premium assistance or cost sharing reductions. You would have to pay full price for your Covered California plan. And I think, is there one more slide? Okay. Oh, yeah. So enrolling for Covered California. Again, this is the general rules. This has changed due to the pandemic, but California has set a permanent open enrollment period. Like the federal open enrollment period changes every year, and it's shorter than the Covered California open enrollment period. But for California, it's November 1st through January 31st every year. And you have to sign up by the 15th of the month if you want your new plan to start the first day of the next month. And California did restore the individual mandate, which was originally part of the Affordable Care Act that basically penalizes you on your taxes if you went without coverage for a certain number of months. And that went away for the federal rules. But California does have an individual mandate, but there are a lot of exemptions. So folks who have pretty low incomes, they wouldn't have to worry about the individual mandate, and people who aren't eligible due to immigration, as far as I know, are exempt from the penalty as well. A special enrollment period in general years is a period where you can sign up for coverage outside of the regular open enrollment period. Your private insurance that you get through your employment is similar, but this, it requires a qualifying life event in order to sign up outside of that general open enrollment period. And those are some of the examples of qualifying life events, and that lasts for 60 days before and after the qualifying life event. So that's how you can kind of get around the open enrollment dates. Okay, and this is just a quick slide on some of the options that might be available for undocumented people. Like we said before, they can't purchase Covered California either for full cost or with premium assistance. So Covered California, including people who have DACA status, are not eligible for Covered California. They are exempt from the individual mandate. Undocumented folks are exempt from the individual mandate. But they can, restricted Medi-Cal is still available if they qualify, and that would make them eligible for emergency care. And we just kind of have to advise about different non-emergency community health centers or safety net hospitals that might be available for ongoing care for folks who might not qualify for Medi-Cal or Covered California based on their immigration status. And one thing that I forgot to put in here, but Tiffany mentioned it earlier, is that California opened up Medi-Cal eligibility for people under 26, regardless of their immigration status. So that's a great option for the young adults and children could qualify, possibly when their older folks can't. I think with that, we can start answering some more questions. We have about 10 more minutes to answer questions.
Yeah, I'm going to jump in for Nicole and read some of the questions off. I'm going to go up a little bit more in the chat. This might be a question that refers to the previous section. I'm not completely sure. The question is, can a person receiving benefits, or I'm sorry, can a person receiving federal retirement qualify?
Do you mean like federal, like Social Security, or like as a federal employee?
Lynn, feel free to pop back into the chat to provide a little context for us.
And I guess qualify for what? Can you be a little bit more specific?
Maybe while we wait for Lynn to give us a little more context in the chat, I'll ask the next question. So the question is, can you submit bills from multiple months in 1 month to reduce the amount you pay on share of cost, or can you only submit multiple bills for the same month?
The first, yes, you can save your medical bills from different months and then use them in 1 month so that you reduce it for that month only. That's a common strategy that people use.
Okay, I'm going to go to the next question. It's, can a person 65 or older with Social Security qualify for working disabled program?
This one is tricky because so technically they can. There's no age requirement for the working disabled program. However, you have to have a disability determination, and a disability determination can be hard to get when you're already retirement age, because Social Security isn't going to give you a disability determination when you're eligible for retirement benefits, because to them it's you know, it's no longer relevant for their purposes. So there's a certain age, it might be 65, after which the state will not do a disability determination either. So if a person it becomes disabled and has received Social Security disability before they turn 65 or 62, and then they age into, you know, if they age into age 65, then they can stay on the working disabled program, but it's going to be tough if they don't already have a disability determination, because that's required as part of the program.
Yeah, and just to add, maybe you didn't get on the working disabled program when you were under 65 and getting disability, but because disability converts to retirement after age 65, if the basis of your retirement after 65 was disability, that would be fine. But like Amy said, it's difficult getting that disability determination after retirement age.
So I see the, it looks like Lynn specified on the question. So I don't know specifically with any like federal employee retirement health benefits, like specifically, but a lot of times employers have insurance options for people who have Medicare that kind of complement Medicare. So that would be just something to look into, like HR or whatever. I don't remember what federal department it is that deals with employee retiree health benefits, but you can have Medicare and private insurance at the same time, and a lot of people do. Tiffany, do you want to add anything to that?
No, sorry. Every time I try to mute myself, I accidentally, somehow the screen changes. I don't have anything to add beyond that.
I think we have time for just a couple more questions. So one question is, can someone apply for Covered California if their spouse is already collecting SSDI? Does that income need to be counted?
Yes. For Covered California and for Medi-Cal, if you are married, they're counting everyone in that household. Medi-Cal is a little bit different in that if you live apart from your spouse, Medi-Cal won't count that spouse's income. But for Covered California purposes, especially if you're receiving those tax credits, you are required to file jointly on your tax return, and the income from your spouse would be counted. And SSDI is one of the Social Security benefits that they tack on to the adjusted gross income for MAGI purposes.
Okay, and there's one more question here. Would there be any other route to help a client obtain that disability determination after, say, age 70?
I mean, we've been talking about this a lot lately because we have wanted to get people, help people get a disability determination when they're older. I'm not aware of any way to get a disability determination at that age. Tiffany?
Yeah.
Yeah.
I don't either. Like Amy said, either you get that determination with Social Security itself, if Social Security will not do it, or if Social Security finds that you don't meet the Social Security definition, Medi-Cal has their own department called the DDSD, it's the Disability Determination Services Bureau, that does their own determination. It is based on the federal Social Security rules, but we have seen that the county also will not refer people to that department to get that determination. And we've spoken to outside agencies that are experts on Medi-Cal, and it is a regulation or rule that DHCS follows about not finding disability after retirement age. So we, at this point, have not found an exception to that, which does make it very hard because that working disabled program can be so helpful for so many people.
Thank you for answering that. I think we'll stop here. If you think of any more questions, don't forget that there's a session on Thursday, the 20th. And with that, I'm going to pass it over to Nicole.
Thank you. So I did see another question come in. We just want to reiterate part 2, Thursday, same time. It'll be a lot more interactive. They'll go through examples. So we hope you'll be able to join us then. In the meantime, we'd really appreciate if you just take a couple of minutes to fill out a feedback form that Mark's going to pop in the chat right now. We are really intentional and spend time looking through every single response because it really helps us tailor our trainings and bring content that you want to see and that's helpful to you. So thank you. And without further ado, we will see you on Thursday, bright and early at the same time. And thank you both, Tiffany and Amy. That was really great content.